Does my slide already view?
Yes, sir.
Okay, thank you very much. First of all, I would like to express my gratitude to the Dean of the Faculty of Medicine, Professor Dr. Dwi Pujonarko, and also Head of the committee, Dr. Adrian, for the invitations for me to uh, deliver my today's topic related to the ethical and legal aspect of personalized treatment. Previously, we already heard from Professor Hardin that personalized treatment or nutrition give a lot of benefits, but we also need to realize that this kind of advancement in medicines also have a lot of ethical and legal considerations. Today, several topics will be my interest, and hopefully we can uh, discuss it later. So, I would like to start with the definitions or scope of the personalized treatment. As previously stated by Prof. Hardin, he stressed on the personalized in the nutritions. But how about the personalized treatment, or we can say precision medicines? We can we the precision medicines is the individualized care based on knowledge of person's genetics. So in this first scope, we already have at least that this kind of uh, scope, the genetic testing, the genetic technology has already pursued its own dilemma. In the next item that we have to pay attention in the personalized treatment is the lifestyle in the environment which encompass a wide spectrum of use genetic informations, including predictive risk testing, risk assessment, diagnostic testing, pharmacogenomic, molecular profiling, population screening, and direct-to-consumer genetic testing. In this scope, we already realize that genetic informations will be the main topic, the main reasons that we have to pay attentions. The American College of Physicians has already uh, released a statement. When we develop the genetic testing, at least several questions need to be addressed. The first of all is it analytically valid? Does it accurately detect the presence or absence of genetic variant? Second, is it clinically valid? Does it accurately relate to the variant to the disease? The third, is it clinically useful? Will the result inform the diagnosis, the treatment, or prevention of disease? The fourth, personally useful to the patients. Will the result provide important personal or familiar information to inform decisions making? Sometimes we know that one person genetic informations will relate to familial background. And the last, as well as the harm associated with the test, including potential negative consequences for the patient's life. The study from Ahmed Lauko shows several ethical issues. In his study, they 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 show several topic related to the ethical and legal consequences. The first is the privacy and the security. We know that the genetic informations will have the very big information related to the health status of the persons, the health status of the familial, and we need to pay attention to the confidentiality, the security, the big data itself. The second is the economic impact. If we talk about the ethical aspect, we also have to realize the social impact. In this case, Professor Hardin also stressed in his last slide that the testing of the genetic information is very costly. Who can afford the treatment? Is it government already give a lot of budget in there, or us as a developing country will have can are able to catch the advancement in the developed country? The issues about discriminations, about the informations from the genetic testing, the informed consent, the accuracy of testing, with some which comes sometimes will result in the anxiety of the patients. Is it already the best or the accurate result, or still there are argument in the results? The topic about privacy and confidentiality and security is sometimes beyond the data of the genetic informations. Sometimes we know, unfortunately, the health status of the patients, not directly related to the main problems. And also, we can also know the relations of the genetic informations with the family. And in this case, we have to be transparent to the patients. We have to educate the patients that the informations will give very big impact to the not only to himself or hisself, but also to the relative or the society. In the Indonesian School of Medical Ethics, Article 10 and Article 16, we know that the patient has the right to check the free choice of treatment and the adequate information related to consent, related to refusal of treatment. And we have to pay attention to the privacy and the personal safety and the legal protections of the health data. In the economic impact, we have to remember the four-box method from the Johnson and Ziegler in the clinical ethic. In the right quadrant, we see that there are medical indications, patient preferences, quality of life, and contextual feature. Sometimes the personalized treatment may give the beneficial output for the patients. It may increase the quality of life of the patients, and the patient also consent to give the treatment. But sometimes we face the contextual feature, saying that economic impact of the treatment itself, the actual cost of the medical treatment, and the implications on the insurance. We, as a developing country, maybe have a different kind of uh, economic problem compared to the developed country. And also, the economic problem may increase the disparity in the healthcare access. They who have much more money can uh, have higher access compared to the lower economic status. And the loss of insurability due to having a genetic conditions. By knowing the genetic informations, it could result in the problem of someone having a job or some discrimination or stigmatizations in the community. In the Non-Discriminations Act stated in 2008, which have a more legal standing for the patients who run the personalized treatment. In the Indonesian Code of Medical Ethics, Article 3, we know that we need to practice in the independence method, providing medicines, health devices, product recommendations, or medical actions for direct patient service, which apply science, technology, medical skills that are not based on scientific evidence is not recommended. We have to n- understand the scientific evidence of the treatment. We have to deliver these informations to the patients so that the patients will together reach the understanding and make the best interest for himself and to make responsible decisions making. According to several studies, the personalized treatment may result in discriminations. Why? Because in the genetic informations, it developed from the specific populations. It's developed from specific ethnicity. Questionable is it could it be generalized to the populations? Of course, it should not be able to do generalizations. Professor Hardin state the challenges in our community that we have a diverse populations, and we need to have the basic data of our population. So we can we will able to develop our own treatment to our community. In the International Code of Medical Ethics, which established in 2022 last year, in the duty to the patients, the physicians must practice medicine fairly and justly and provide care based on the patient's health need without bias or engaging in discriminatory conduct. So, to reduce the discriminations and stigmatizations, we need to be able to improve our understanding of our patients' need. How about the issue of informed consent? Clinicians need to help patients understand, especially about the probabilistic risks. We know that the genetic informations sometimes is still under research and sometimes have only known its probabilistic informations. So based on these informations, we need to uh, gather with our patients to have the common understanding. So it may guide the preventive and therapeutic interventions and also the decisions from the patients. We need to have clear communication and the use of simple language. Why? Because the informations related to genetic testing is very complicated. We need to get the simple delivery of informations to our patients. In the Article 13 of International Code of Medical Ethics, in providing medical care, the physicians must respect the dignity, the autonomy, and the right of the patient. The physicians must respect the patient's right to freely accept or refuse care in keeping the patient's value and preferences. Thus, in giving information to the patients, we have to listen to what is his value, why he accept to do the testing, why he refused to do the testing. In decisions making itself, we at least can follow three kind of model or by informative model, paternalistic model, and deliberative model. In the traditional way, we use the informative or paternalistic model, in which the doctor decide what is the best interest for the patients by the doctor decisions. But today, in the open world, in the advancement in technology, in the advancement, the understanding of medical subjects, we have uh, uh, to deliver the deliberative model in which clinicians give the patients informations about his or her conditions and the medical options, along with their advantages and disadvantages, and the patient explain his or her failures and preferences. and together reach treatment decisions. It takes result. How, in the legal aspect, we see the decisions making capacity. Our patients sometimes in the underage, below 18 years, or sometimes already mature, but also in the grown age, but have different situations. Let's say in the mental health status, we have to consider three kind of item which regulate in our legal system. In the based on the mental health, we have to know the understand the experience of the patients about the informations. Could they understand the decisions to be taken? Could they or he or her comprehend and retain the informations relevant to the decisions? Believe it, weigh it to arrive at the choice, not just slight understand and a slight consent of the informations. In the clinical decisions making, testing should not be done until potential consequences of learning genetic information are fully discussed with the patient. At least several aspects need to be informed about the risks, the benefit, the limitations of the testing, the possibility of uncovering incidental information. uh, when we do the genetic testing for one gene, some to be in the in when we run the sequencing, we will found an incidental information in which it unexpected by the patients. We have to be able to inform this clearly about the health or other implications for family members, the cost, and the other possible consequences, such as anxiety, discovery of unwanted informations, employment discriminations, life disability, or long-term care. And thus, these kind of situations need the collaborations with the genetic counselor. To discuss in the benefit and harms aspect, the scientific and social value carry out in ways that uphold human rights and respect, protect, and are fair to study participants. In benefit in personalized medicine, such as the risk predictions, we will be able to predict the risk assessment. We will able to improve the effective prevention. We will be able to improve the quality of healthcare accessibility. In other way, it also will have the benefit and risks in the time of the patient. In the face of uncertainty, physicians must weigh the benefit and harm of testing and make decisions based on probability. We could not assure the patients and promise the result 100%. It only probability statement in which the patient need to understand. About the diagnostic accuracy, uh, since this technology especially developed in the developed country and still in the many study and research and may result in the anxiety and the uncertainty of the result, which may lead to psychological distress and anxiety and loss of trust. That's why we need to careful in announcing or implementing any discovery of new technical treatment. Apply scientific evidence-based medical practice that have been proven to be true and accepted by medical practice standard. And we need to know that all of this aspect is in the best interest of the patient. How we deal with the anxiety, the communications is the key. We need to provide adequate information in an honest and polite manner, in the properly, thoroughly, and carefully with the right words. We need to be able to telling the truth, but may we could or we may withhold some informations that could weaken the patient's psychological and psychical conditions. in which it may give a more stressful and depressed decisions to the patients. We need to respect the wishes of patients who refuse to receive information about their own illness or actions treatment that weaken their physical and mental health, especially if this result is not expected before. It's in incidental situations. The last for my presentations for the take-home message, the integrations of evidence-based personalized treatment with genetic, with environmental and lifestyle factor into clinical practice have the potential to improve health by predict disease, stratify risk, individual care, and prevent illness. But we also need to understand the ethical, the legal, and social issues should be strongly considered to ensure protections of the patient's right as well as equitably distributions of beneficial outcome. Thank you very much for your attention. I will back this to the master of ceremony. Thank you.
Well, thank you very much, Dr. Tuntas, for your insightful presentations. And in appreciation